I decided to bring laser therapy into my clinic because I felt that I was missing a key component in treating patients. Treating soft tissue injuries is very complicated, and as a chiropractor, I can get to most of the problem, but there's always that last little bit that the patient needs help with, and it is a painless therapy that works exceptionally well on those types of injuries.
Yeah, I've had other treatments here besides chiropractic, you know, in spite of the fact that the maintenance keeps me in pretty good shape. You know, being a human, I sometimes do things that aren't always the most intelligent things, and recently I pulled my calf muscle very, very severely, like to the point where my leg had swollen and I was getting bruising and whatnot in it, and I did half a dozen laser treatments, and I'm really amazed at how much better my leg feels. You know, like, I mean, this isn't the first time I've pulled my calf. This was probably the most severe case, and I've never had it heal as quickly as I did with the laser.
As a new patient comes into our office, we usually do a consultation, a full history and examination, and decide whether or not the laser is the appropriate treatment. Thereafter, usually the laser is set up per prescription, so per body part, and it can range from 40 minutes to an hour depending. The intensity of damage and how long the damage has been there will dictate how long the treatment or how many sessions the patient is required to have.
I have degenerative osteoarthritis in both knees, and I have had surgery 5 times, 3 on my left side and twice on my right side, to clean up the damage that's happening because of the disease process. I was having chiropractic treatment on my back and was complaining to Natasha that my knees were aching and I was waiting for a surgical consult, and she suggested that I try the laser therapy on my knee, and we talked about it for a few minutes, and I thought, we can't make it worse, so I tried it. She said I would probably need 10 sessions, and after 7 sessions I was completely pain-free.
She's fantastic. She's been treating me for all my new running injuries, because I took up running a year ago and overdid it as usual, and injured myself, and she really was instrumental in fixing my running injury.
I would say the best response that I have from the laser would be knee and hip. Tendonitis is a really easy one, as well as any sprains and strains, and those are just very basic and common. Those are the most common things that come into my clinic. There are so many things that it can treat that people just don't know about.
I've had laser treatment for both knees, and I don't know if it's hereditary or not, but when I bend down and crouch down, when I used to bend down and crouch down, it was almost like the knees were locking. When I got up, it was very painful. After 4 laser treatments, the knees were completely back to normal and full range of motion.